Hello, I'm Dr. Ahmedov, one of the transplant surgeons from Smile Hair Clinic. Welcome to our YouTube channel. Today we have a small review with one of our patients, Costin, who had this hair transplant surgery back on 25th of August of 2021 in our clinic. We are going to talk with him about the results and plan his second step surgery. Welcome, Costin. How are you? It has been a long time, already 1 year.
Yeah, one year. Time flies.
Time flies by. You look really different, actually.
Yeah.
How do you feel?
I feel like 10 years younger right now.
I told the same thing when I saw the before and after the pictures. Hey, this is Costin, we're really happy to see your results. Actually, before we proceed, I just want to show you how the Costin used to look before the surgery and how we planned his first surgery. Costin had the surgery in our clinic, as I told you, on 25th of August of 2021. So this is Costin's before the surgery picture. Okay, Costin had the Norwood type 5 to Norwood type 6 of the hair loss. What does it mean? It means the loss of the front hairline, open area in the front side, loss of the front hairline, open area in the front side, mid-scalp, and an open area in the crown area. So basically, all three areas were affected by hair loss. So this is the front and the mid-scalp, as you can see from here. Loss of the continuity of the front hairline, open area in the front side, mid-scalp, and an empty spot in the crown area. For this type of patients, on average, we may need something between 4,500 up to 6,000 grafts to cover all the open areas. We planned a two-step surgery for Costin's case. With the first surgery, we were planning to rebuild the front hairline, cover the front side, and the mid-scalp. And with the second surgery, around 1 year later, we planned to do the rest of the crown area. In between two surgeries, we also advised the Costin to have a medical treatment with finasteride. So this is the Costin's planning of the surgery. Here we can see we rebuild the front hairline, mark the open areas, the front tuft, front mid part, the mid scalp, and a part of the crown area. With the first surgery, we extracted from Costin's donor area that was really well, around 4,050 grafts. And now to understand the difference, I just want to share you some before and after picture of the Costin, just to see how the planning was done and the final, the final results of the surgery 1 year after it. So this is the Costin's planning of the surgery that was carried out on the right side on the day of the surgery. As we have told before, like the front hairline is rebuilt, the front part of the line is marked, front tuft, and the priority zone in the front mid part. The mid scalp and the crown area is also marked. And you can see here on the picture on the left the result. Our purposes of the surgery, we acute them. So the front hairline looks much more mature and solid. The front area is covered and all that empty spots are gone. This is the Costin's picture before the surgery, how it was before. And this is 13 days after the surgery when the scabs were off of the head. And here is the final result from the front side. The front line is completely reconstructed. Okay, one of the biggest points that we pay attention at Smile Hair Clinic when doing the hair transplant, specifically the front area, one of the pitfalls that we can see is the frontotemporal transition zone, or transition of the front line into the temples. That's one of the biggest mistakes that carried out most of the time during the hair transplant surgeries and not paid attention to. Because this transition from the front side to the temples gives a natural outlook of the hair. Because the direction of the hair in this angle is really different. The temples, direction of the hair, they actually grow downwards, and the front line, it actually grows a little bit to the inside and at a specific angle. And you can see here, when the temples are rebuilt, they're very natural, just like his own hair. And his left side of the head. One of the key marks or like pitfalls where we catch up the like not a successful hair transplant surgery, this frontotemporal transition zone. What was the big Costin? What was the biggest difference that happened in your life within this 1 year?
Well, it was the biggest difference was in the morning when I looked up in the mirror and I saw that I tapped on the head and didn't feel the bald spots and didn't have to cover it with the remaining hair
With the remaining
to
hair.
comb it over.
Okay, what about the like your general psychological status? What about your self-esteem? Did it become better like this?
Yeah.
What was the main difference?
Well, every time I went out of the house, I feel a little bit anxious about the hair. What would the people think about it? And when I tell them that I'm only 24, 25, and see that problem.
Actually, here is the point. Most of the time when the patients come here, one of the biggest problems we have with most of the patients is the recession of the front hairline or the loss of the continuity of the front hairline. Front hairline is the frame of the face. And front hairline and the front area of the hair, this area specifically gives up to the 60 or 70% of the outlook of the patients or the human being. Whoever sees you when you're walking outside, most of the time they see you from this area. So it's very important during the hair reconstruction surgery or hair transplant surgery to rebuild the front hairline as natural as possible, give a good density in the front side. Because it's your ID card, that's your identity. That's why when we specifically do this kind of surgeries, we pay the biggest attention for the density, direction of the hair, the angle, and the distribution or the density of the hair in this part of the head. Okay, so whoever sees you, as we told you, they see the front line. So that's your ID card and your identity. As we mentioned before, Costin had normal type 5 of the hair loss. For this type of patient, most of the time, we plan a 2-step surgery. Today, Costin has arrived to our clinic to undergo his second hair transplant surgery. But before we start with the planning of the surgery, one of the questions I want to ask you, Costin, did you go with the medical treatment? Did you get any medical treatment after the surgery?
Yes, I went with finasteride 1 milligram per day, and with 5% minoxidil.
Here is the point, most of our patients, or this is the challenging point we have. Okay, hair transplant surgery itself, most of the time, is not the only solution for the hair transplant surgery. Alongside with hair transplant surgery, we also advise our patients to undergo a medical treatment. Most of the patients we have here for the hair transplant surgery, they have the phenomenon called androgenetic alopecia, or in daily English it means the next, genetic male pattern hair loss. It is very specific and unique type of hair loss. It starts with the recession of the front hairline, open area in the crown area, and over the years, these areas widen up and end up with big empty spot in the mid point of your head, front side, mid scalp, and the crown area. That's why hair transplant surgery itself is not the only solution. Because with the hair transplant surgery, we try to cover or mask the open areas as much as we can, depending on the capacity and the ability of your donor area. But it's also very important for the patients to protect their pre-existing hair, not the transplant hair, and prevent furthermore hair loss. That's why there are only 2 medications in the world today that really work to protect this situation. Number 1 is the finasteride 1 milligram tablets, and number 2, minoxidil 5% solution. Okay, the biggest challenge we have actually not with minoxidil but finasteride, it's a really a myth regarding its potential side effects. Most of the patients are concerned about the potential side effects of finasteride. Okay, Costin, you were going on with the medical treatment on finasteride for almost 1 year. Are you still on finasteride?
Yes.
Okay. Did you have any side effects with finasteride? Any side effects or any complications while you were on medications?
No, I haven't. I read about them, but in time I checked if I have any of it, and there was no sign of any side effects.
Okay. the point is that the finasteride 1 milligram tablets, the standard treatment regimen for the androgenetic alopecia, is very safe medication. Of course, just like in any other medication, there can be some side effects. But because the dosage is very, very low, actually, 1 milligram is not high dose, the potential side effect ratio of finasteride is really low. It's around 1.5 to 2%. So basically, out of 100 males who use the finasteride 1 milligram for androgenetic alopecia, maybe 2 of them will have the side effect. The rest, 98% of them, are perfectly healthy and happy. And if any side effects happen, of course, you should stop with using the finasteride. And after you stop it, everything goes back to the normal. In our practice, we very widely use and advise the medical treatment of the hair loss. It's a very crucial aspect of the hair transplant surgery and hair loss treatment. And what about the minoxidil? Was it challenging for you to like be on minoxidil, wake up every day, put it over your hair, apply it, do some gentle massage? Was it annoying, or you just get used to it all the time?
By the time I get used to it, it was a bit harder when the hair was longer and I have to brush it before getting to the
Okay, how was the way you used to use minoxidil? How many times a day you use it, and what was the frequency actually?
I use it twice a day, in the morning and in the evening. Every day.
Okay, for how long did you use the minoxidil? Are you still on minoxidil, by the way?
I am not on minoxidil. At some point, I had some problem with the dandruff, and I stopped it for a while. And then, in that period, while I treated the dandruff, I planned the next surgery, and I read that 2 weeks before the next surgery, I should stop it for using it.
Okay.
And I'm planning to use it again after the surgery.
Okay. Actually, Costin explained as one of the most common side effects of using minoxidil. When patients use the topical minoxidil 5% solution, the most common side effect is dermatitis-like symptoms. It's like redness, itchy feeling, some greasy feeling on their head, some dandruff. Patients express it very simply. They tell us most of the time, it's like, it feels like I haven't washed my hair for a couple of days. Some patients may have the side effects. At this point, we advise our patients to lower the dose, maybe to use the minoxidil for only once a day and use some moisturizing like ointments over the head, like argan oil, coconut oil, or aloe vera, just to make the skin a little bit better and cold. So actually, Costin's case is a really good symbiosis of the surgical treatment and medical treatment that went on together and gave us really good results. When we first saw the Costin first, he looked like a guy who's in like maybe mid-30s, but hair itself changed the male's or any person's face completely. Now he's without his eyeglasses. I remember him with the eyeglasses, with your self-esteem a little bit down, a little bit anxious guy. Now at least you have the face and the frame of the face, and you have changed a lot. You now look like in your mid-20s, not like in your mid-30s actually.
Yeah.
So the next step for us will be, now we'll plan the second step of the surgery. So with the first surgery, as we remember, we planned to cover the front side and the mid-scalp. Now with the second surgery, we'll be planning to reconstruct the crown area. Why we advise the medical treatment between into surgeries is also one of the aspects is trying to save as much hair as we can, and maybe till the next surgery make the crown area much smaller. And you can see it from the pictures that is shown that the crown area is much larger, the area was large. In the first surgery, when we did the measurement of the crown area, it was almost 90 centimeters squares. With the rough density of 25-30 grafts per centimeter square, maybe, at least for this area, we would need something between like 2.5 to 2,700, 2,800 grafts to cover with a good density. But now, as you can see from after the surgery or with the result of the surgery, the crown area became smaller. So number of the grafts we may need for the second surgery will be less. Okay, this is our patient Costin's 1-year result. You can see the front hairline is very well restored. The direction of the hair, that is very crucial point of the hair transplant surgery, is very even, looks really natural. The most important one in parts of the hair transplant surgery, a pitfall that we have talked about is that, like this frontotemporal transition zone, or transition of the hair from the front side to the temples. You can see we kept the natural look of this transition that gave even a better outlook to the results of the surgery. You can see the density is good, the direction is good, so it covers most of the open areas. We shouldn't forget one very simple rule. The hair transplant surgery in its fundamentals is the creation of the illusion of the hair. It's not only hair replacement treatment. We have to distribute the grafts under the specific angle and direction so they can give us a good outlook of the hair. So with the second surgery, we are planning to reconstruct the crown area and adjust a little bit of the density to the mid-scalp in Costin's case. So now we'll be marking our priority zones, do some measurements, and get ready for the surgery. We are now marking the crown area, and we will be measuring the size of the crown area to do the rough estimation of the number of the grafts we may need for the second surgery. The reconstruction of the crown area is a little bit different and maybe a little bit more challenging aspect of the surgery because the direction angle of the crown area is slightly different. As you can see from the top, all of the time the crown area has a specific anatomic area called the whorl. So actually the hair starts from the one point and as a spiral goes around, and hair actually grows as a circumferential in the crown area from one side to the other. So basically like laying over each other. So it's very important during the hair restoration surgery to rebuild this whorl and go with the direction of the natural hair. And the second aspect is the angle of the incisions and implantation of the hair. Here in the crown area, it grows in under the specific angle. It's a little bit more steep compared to the front side on the mid scalp. We're measuring the crown area. So it's 9 by 11. So basically like 10 by 10 centimeters. When do the calculation of the area of the crown area, we use the rule of circle in geometry. And in geometry, when we calculate the area of the circle, it goes with the formula called PR square. PR is a universal number that is 3.14, and R square is the half of the diameter or the radius of the circle, or the half of the diameter. So it's like 10 by 10, so the half is 5. So 5 times 5 is 25 times 3.14. It will be something around 78.5 to 80 centimeters squared. So we have around 80 centimeters squares of the open area in the crown area. You can see here there is like an inner area and an outer area. The inner area or inner rim is the area that lacks most of the hair, and we will have to implant here slightly higher number of the grafts. So the big rim is 80 centimeters squares, and the smaller one is actually 6 by 6. So it's around 30 centimeters squares. So 30 centimeters squares will be implanted with a slightly higher density and with a slightly lower density on the outer rim. So we'll give it a more natural distribution. And the second part of our surgery will be the adjustment of the density to the mid-scalp, or the transition from the mid-scalp to the crown area. There is a small area here that we will be marking. That will be also an important part of our surgery. 6. So it's around like 5 times 6, but we use the rule of square to calculate the area of the open area here. So it will be around 5 times 6, 30 centimeters squares of the open area here. So 30 centimeters here and 80 centimeters squares of the open area here, but our biggest priority will be this an inner circle, the mid-scalp, and then a transition from the inner rim to the outer rim. Now we would like to show you the condition of the donor area 1 year after the hair transplant surgery. After the extraction or after the FUE hair transplant surgery, you may see small dot-like scars at the back of the head. What you should keep in mind is that all type of surgeries will leave scars. There is no scar-free surgery, or there isn't a type of hair transplant surgery that leaves no scars. With an FUE, you will have a small dot-like scars, and to mask the scars, a specific hair type or haircut is also an important aspect. So slightly shorter hair at the bottom and slightly longer to the top will be really useful and efficient to cover small dot-like holes at the back or scars at the back of your head. You can see the donor density is still good. We were able to get around 4,000 grafts with his first surgery. It was actually a mega session. The density is good, the distribution is good, there is no empty spots or like patchy areas at the back of the head. So in total for the second surgery, we will need something around 1,500, 1,600 for the crown area and around 400 to 600 grafts at maximum for his mid scalp. So the number, something around 2,000 grafts should be enough for us to cover all 2,000 to 2,500 grafts will be enough for us to cover the rest of the open areas in Costin's case or for the second surgery. Costin, this is our plan for the second surgery. We have two priorities here. Priority number one is the crown area. You can see it here, it's marked. Crown here, area here has two distinctive areas. There is an outer rim here, you can see drawn, okay? And there is an inner rim. You have more hair loss in the inner rim. And there is an anatomic structure here we call the whorl, or that gives a spiral look growth to the hair in the crown area that actually gives you a natural outlook. We'll put more density in the inner rim because it has more hair loss compared to the outer rim. Okay, for this area, for the crown area, for the inner and outer rim, we will need something around 1,500, 1,600 grafts to cover all the areas. Okay, and we also have a small empty spot in the mid scalp here. It is around 30 centimeters squares. So our second priority, alongside with the reconstruction of the crown area, will also be to increase slightly density in this area. Okay, for this side, we'll need something around 600 or 700 grafts. So all in all, to cover all two anatomic areas, the crown area, and densify or do the densification of the mid scalp, we'll need something between 2,000 to 2,500 grafts. Your donor ALS still looks good. I think we will be able to get this number because the density, the distribution is good condition. So we have two priorities. That's number one, and that is number two. Okay, is the plan fine with you?
Yeah, it looks very good.
Okay, good. So that's actually the plan for Costin's surgery. Okay, Costin, do you have any questions? Is everything clear for you about the second part of the surgery?
Yes, you explained very well.
Okay, you're an experienced patient, but once again, as you know, we do an FUE procedure, okay? FUE consists of three basic steps. It's like extraction, incision, and implantation. So the next step will be the haircut, and as I like to tell it, it's for free. The haircut will be for free, and after the haircut, we'll first start with the extraction. We'll try to get something around 2,000 to 2,200 grafts, and after that, we'll go with incisions and implantation, okay? So good luck with the surgery, and I'll be seeing you in the operating room. Cheers, welcome once again.